So here we have a gentleman. He is from Egypt. And would you please tell us the story? What brought you to us?
I come from Egypt. I'm 61 years old. I have broken 53 bones in my body during my life, and I've got 20 screws in different parts. And I was looking for a doctor like Mr. Michael here, and I finally find him after 61 years, so he would readjust me to my normal physique so I can be doing my normal things again.
Tell us about your more recent injuries and your stroke, etc.
6 years ago, I had a stroke which had paralyzed me in my left side, and it took me some time until I had got up on my feet, like 4 months. And then I fell 6 months ago and I broke my vertebra, and I took 6 screws and a plate and an implant in the hip, and I lied in my back 2 months and wheelchair another 2 months until I been here now after 2 months also. So 6 months in total that Michael have been doing a lot of work with me to get me standing without crutches, walking without crutches, and I am feeling much better already. I wish I knew Michael much before now.
When you say that you can walk now without crutches, I'd like you to tell me, why couldn't you walk without crutches before? What was it that was missing?
What was missing was muscle. My muscles, after I slept in the bed for 2 months, because this area you cannot have any cast, so you had to lie down, and my muscles had gone dormant, and when I used to get up from bed, I could not stand because of lack of muscle. I needed 2 people to hold me from the side to get up, and it was a lot of pain to walk. I was walking with a walker, and then the walker became crutches, and now I'm getting rid of the crutches slowly. But it's making me go through in the airports very well, these crutches.
This is your shoulder, right? This is the big humeral bone that makes up your shoulder. This is where your clavicle comes in, and this is your acromion. So this is basically the round bone where it should sit, but you can see all these extra pieces here. Can you see that? So all these extra pieces here are extra bone formation.
Extra? Oh, you buy 12, you get one for free.
Yeah. So if you look here, there's a massive calcification here, most likely sitting in what is called the supraspinatus tendon. Yeah, and we can see one down here as well. So it should, in the ideal world, I would have liked it to look like this, nice and clean. Are you with me? But unfortunately, that's not the case. So we are seeing a lot of calcification in it. So you get calcification when you have an area that has been traumatized, right? So you've had many falls over the years on the shoulder, and the way that the body sometimes repair is after the inflammation, we can get a calcification of a tendon. And that is why we now have so much discomfort in the shoulder. Solution, shockwave therapy. Also shockwave therapy and exercises for that shoulder. But the
shockwave will dissolve this extra bones,
breaks up the calcification.
Okay.
And then exercises help to rebuild the functionality and muscles, because now, because of the calcification, you haven't got full range of motion.
I got the full range, but pain. There's pain inside.
So if we see you lifting your arm up fully, you're actually not lifting it fully. You compensate by using your body.
Okay.
Yeah. So we want you, the plate exercise, we need you to be able to do that. Okay?
Okay.
Are you with me so far?
Yeah.
Good. Perfect.
What you mean is more work. Okay. Good thought.
On your front, please. Let me just give you some paper here, just in case.
You know how many accidents I had? I missed the sidewalk with just few millimeters, banging my head without helmets.
On the motorcycle.
Yeah.
Yeah.
I should have been gone a long time ago.
This is a gentleman that have had multiple injuries, had a lot of fractures, has had a lot of screws, plates, etc. put into his body. But it doesn't mean that you can't optimize the function of the body with what you have got. So what we're doing, we're adjusting the gentleman, we're getting maximum movement into his spine, we are making the nerve system wake up again, making it easier for the nerve system to function. And then we use that increased mobility and better nerve function to do rehabilitation exercises. And slowly, step by step, make it possible for the gentleman to take control again and return to the activities he loves doing. Okay, take a big breath in for me here, please. And out. Good. And another massive breath in. One more. Beautiful. Lie on your right side for me, please.
There's only noise, there's no pain. Huh?
Okay. Good. Over to the other side, please. Good. Okay. Hold on to yourself. Excellent. And back to your back. So roll over there. Perfect. Good. I'm going to take your boots off, okay? Because the weather is so nice, you don't need those big boots. Good. Okay. Now we're going to get movement into your hips. And relax for me.
You're teaching your techniques, huh?
Yeah. Good. And go floppy for me. Good. Keep breathing. Big breath in and out. You're doing good. You're doing good. Really good. Excellent.
It's fear, this one.
Yeah, that's okay. Gently push towards my hand here. Gently. Hold the pressure. Hold the pressure. Keep holding the pressure and let go slowly. Beautiful. And again, push. And let go. And push. That's good. Keep that pressure. It's beautiful. And let go.
No.
Well done. Excellent. So now you're going to come down this way towards me. Down that way. So I'm going to, yeah, and then legs out off the table again. Feet out there again. On your back.
Oh.
Yeah, like that. Perfect. Good. And then down on your back. There we go. Yep. And Smile. Smile. That's a grimace. Can I have a smile? Oh. Beautiful. Beautiful. Good. When you're ready, sit up. Good. And face this way. Good. Good. Well done.
My addition, he is very friendly and he approaches psychologically before physically.
So what we're seeing here is that the patient is being strapped up for chiropractic biophysic traction. Here we want to stimulate the spine to develop its lumbar lordosis again, the backwards curve of the lumbar spine. We also want to get the thoracic spine forward. So basically what we have here, we have lost the curve in the low back and we have got too much backwards translation of the thoracic spine and too rounded shoulders. So you will see a combination of a series of postural correction tractions that this gentleman is undergoing. And this is done immediately after the adjustment. So the spine has been stimulated and the patient comes straight into our traction area and we start the process of re-educating the spine into a new position. The setup in the traction is crucial. We have identified 100% where the spinal misalignments are. And based on that, knowledge of the position of the spine, the patient gets put in to a position that does the mirror image of what the faulty posture is. So over time, force over time applied to the spine, slowly re-educate the spine. We then combine that with a series of exercises in order to maintain the muscular postural control. So here we are seeing that the head is being pulled back. We're introducing cervical curve by putting a contra force in the opposite direction that sits in the middle of the neck. The patient then gets loaded. And when we do these kind of tractions, we start on a very low load and then we slowly increase time and weight. And during the traction, if need be, we tighten it slightly and we obviously stay constantly in communication with the patient about how this is feeling. One of the things that we're doing with this gentleman is backwards walking. There's more and more research that is showing the massive benefit of backwards walking. When you do backwards walking, you reset the neurological parameters because every signal from the ankles and up is the opposite of what we're used to. Obviously, the gait pattern is opposite of what we have been doing for years. When you do that, we're seeing with a lot of patients with long-standing chronic problems that we are able in a relative short period of time to get them out of pain, but also reestablish the neurological function much faster than what we've been able to do in the past. So as you can see with this gentleman, we start off very gently and we are trying to get him to take big steps and keep as upright and as balanced as possible. We obviously have a neurological deficit down one of the legs, and by doing this, we get the neuronal pool, the neuroplasticity gradually to start learning more of how to walk. And we're seeing over and over again, by combining backwards walking with other rehab forms, we get faster results. And fingers only, don't lean on it. Just your
I
fingers for
like to
balance.
hold on the motorcycle.
Yeah, but that is not allowed. 2 fingers only. Yeah. 2 fingers only. You're not allowed to push down. Just hold the fingers. There we go. That's as, and then remember, bend the legs a little bit more so we really get those thigh muscles going. Yes. Fingers. Good. That's really, really good. More centered. Yeah. Perfect.